So good afternoon, everybody. I'm Dr. Mark Letterman, and I'm the Executive Director of the Connecticut Podiatric Medical Association. CPMA this year is hosting our annual symposium at Foxwoods Hotel and Casino down in Ledyard, Connecticut. And we're very excited about the program this year. It's different, and we're bringing a lot of fantastic speakers with great topics from around the country and even international. So today, just to introduce you to one of our speakers, I'm joined by Dr. Perry Lin from Columbus, Ohio, who's going to be speaking with another physician on physician wellness and suicide. How are you doing today, Dr. Lin?
I'm doing great. How are you?
Fantastic. Thanks so much for joining me. So can you just tell the audience that will be listening to this ahead of the conference just who you are, a little bit about your credentials and your practice?
Yeah, certainly. So my name is Perry Lin. As Mark said, I live and work in Columbus, Ohio. I am in the world of education, so I train residency. I'm in a residency training program at Mount Carmel in Grove City. I work with internal medicine residents, but more on the professional side of things, relevant to this particular meeting, I am the national co-chair of physician suicide awareness at the American Association of Suicidology. And I'll be talking about physician suicide, but really the story behind the numbers. And I'll be joined with another physician, Dr. Lois Swisher. She is the co-founder of National Physician Suicide Awareness Day, and she's my co-chair at the American Association of Suicidology. She's an emergency physician, and she also works through Drexel's medical school as well.
Great. So our national newsletter, APMA, had a feature article a couple of months on this from one of our board of director members who shared an unfortunate story about one of his colleagues in Indiana. So how big a problem is this nationally?
I think, unfortunately, the problem that we have is an undercounting of numbers. For those of us in the healthcare field, those of us that are physicians, there's a lot of professional courtesy that is extended to other doctors. And when somebody somebody you've interacted with in the community shows up to your emergency room or you're signing their death certificate, we understand the ramifications of adding suicide as a diagnosis. Sometimes life insurance doesn't get paid off. There's stigma associated in our fields. And ultimately, we have a very undercounted number. It's much larger than we think. But more so this year than has been present in the last couple of years with COVID, there has been an increased stressor on all doctors around the world and around the country. In our field, more than many other fields, we tie our personal identity to our professional identity. When I go out and I introduce myself to people, a large part of my personal identity is my job, being a physician, caring for other people. And that intimate connection between the two has really been tested. In this last year, we've had offices shut down, people go under extreme financial strain, people lose jobs at last minute, being asked to be a hero when all of us want to help people. But we didn't go into fields like being a police officer, a firefighter, the armed services. We didn't sign up for a job initially where we thought we would be putting our lives or the lives of our family on the line every day showing up to work. And though I appreciate the fact that the country has recognized the sacrifices we're making, there is a very real personal cost to physicians and doctors every single day when you're taking on that type of burden, when you're putting others ahead of yourselves, and very real because physicians have died as a result of this, going to work before the vaccine and not knowing what type of risk you were exposing your family to. That increased degree of stress, that social isolation, that financial cost has really placed our field this last year and a half in a position where it is the perfect storm for suicide risk. And we never talk about it. It's an open secret. We know it's a problem, but we never have that discussion. And my hope through this presentation that we're going to be giving is I want to give people tools. I want to talk about what the problem is, but more importantly, I want everybody that is here that day to be able to walk away with tools that they can use immediately to address it at the local level. Because when we talk about suicide prevention, it happens at the local level. It happens at your office, at your hospital, you sitting in the physician lounge or going out to lunch with a friend and noticing signs and speaking up and getting somebody you care about to the resources they need.
That's something. And I'll tell you, we're going to have a lot of medical assistants, office managers, multiple specialties present. So I assume it's, certainly colleague to colleague, it's so important to have a level of awareness. Probably important for our staff to recognize when their physicians are in trouble as well.
Of course, and this isn't just something special to doctors only, to physicians only. This expands across the whole healthcare field. Stress wasn't just among doctors. We had nurses under extreme stress being asked to place themselves and work hours that we never really thought would happen. People were making decisions, people coming in to consult on a patient, to do a surgery on somebody. You never really thought going into the OR that day, you would be putting your life at risk. And that includes your scrub nurses, that includes your front desk staff, that includes your nurses, your MAs who are rooming patients. Everybody was under this extreme stress. And we see the same phenomena happening among everybody in the healthcare field. And it is something that we need to talk about and be more open about.
That's great. Well, I'll tell you, I'm very excited that we're having this topic. The topic is tough, but it's really important. And I know that the folks who attend are really going to get something out of this. Listen, I really appreciate you taking a couple of minutes to give us a little bit of a insight into what people are going to be hearing. And I know you'll be speaking on October 8th and in the afternoon, along with Lois. And I really encourage everybody to register for the conference, register early. It's going to be packed and it's going to be fantastic.
Yeah, I am so excited to see everybody there. I think it's going to be an absolutely great talk. Please bring questions. Please speak up. We work best in these presentations when we have engagement from the audience. And I am sure a lot of you have questions. So you have a captive audience. You have us there as experts in this field. And any questions you have, we would love to address and make sure everybody leaves out of here with the tools necessary to be able to take care of themselves and those that around them.
Yeah, that's fantastic. And we'll make sure that happens. Thank you so much and have a great Labor Day.
You too.
Thanks a lot. Bye-bye.
Bye.